Today I'd like to share with you the secret of how I help my most challenging patients. These are pets who have been struggling for a very long time, and they're not responding to the traditional therapies. My secret is lab testing. Now, I'm not talking about your traditional veterinary list of lab testing. I'm looking at some different tests. You see, one of the differences between a veterinary nutritionist and a pet nutritionist might be the lab testing. But one of the big differences between what I do as a holistic veterinary nutritionist and a pet nutritionist, or a veterinary nutritionist even, is that I feel like nutrition is a piece of the puzzle. A large piece, yes, but really just a piece. And the tests that I'm doing are to look deeper to try and find the root cause of what is creating the struggles that your pet is dealing with right now. In this video, I will share many of the tests that I typically use, when they might be appropriate, and why I choose the lab that I do. Before I get started, I really want to emphasize that I'm not foregoing your veterinarian's traditional testing. In fact, many of my patients come to me without certain lab tests that I feel are appropriate, and I will send them back to their veterinarian and say, hey, please request these tests. They may be very, very helpful. What I'm talking about are tests that are outside of your veterinarian's traditional testing protocols. While I am a veterinarian and have a lot of experience with a lot of pets, I am not your pet's veterinarian. This information is for educational purposes only. If you have specific questions about your pet, please talk to your veterinarian, or if you'd like, you can set up an individualized consult with me and we can go through the records and I can help you out. So let's get started. One of the tests that I use most often is Animal Biome's microbiome test, or gut health test is what they call it. This is a test that shows me what's going on with your pet's microbiome, which is the collection of bacteria in your pet's gut. The information provided by this test can give me very specific information about how to rebalance the gut if the bacterial balance is out of whack. The information from this test helps me to design specific treatment to help to rebalance any detected imbalances. The test is simple. It only requires a stool sample that you can collect and then send directly into Animal Biome. There's no need to visit your veterinarian. Now, I'll often recommend this test for pets who are having chronic gut issues, inflammation, pancreatitis, that kind of thing, and that have not responded to a dietary change, or perhaps we've done the diet, they're doing a little bit better, and I want to see where things have landed and if we still need to do some corrections. The test is also really ideal for animals that have had multiple courses of antibiotics, for pets with allergies, pets with chronic illness that's not really responding in other ways, even obesity that's not responding to typical calorie restriction. Now, I choose Animal Biome over the others. There's really not that many other labs that are doing this test. Animal Biome has been doing it much, much longer. They have a tremendous amount of data to draw from, and their results are much more specific than the other labs that I have seen. As an example, there's a test done by a university. It's called a dysbiosis index. And for me, that doesn't really give me any information that can guide treatment. So it's important to understand what dysbiosis is. Dysbiosis is an imbalance in the gut microbiome, or any microbiome. But dysbiosis can be because there's not enough beneficial bacteria. It might be that you've got an overgrowth of pathogens or disease-causing bacteria. Or it may be that you really just don't have much diversity at all. The dysbiosis index doesn't tell me where the imbalance is or what type of imbalance. And the only way I can correct it is if I know where that imbalance is. And so that particular test is not helpful. Animal Biome, on the other hand, gives me very specifics on species and often, or genus and often species. it tells me the amounts of each one that's there, and they have their so-called normals, which is really just a conglomeration of averages from other pets. There is no normal microbiome. It's kind of like a fingerprint. Everybody's different. But there are certain patterns that we do see on a regular basis. So it gives me so much more information that I can work with. Now, and the other thing Animal Biome does is that they will actually separate out the good guys from the bad guys from the commensals. And commensals are bacteria that we know are pretty common in the gut. We don't really know what they do. We don't know if it's beneficial or not. But they're there, and they don't seem to be causing too much problem. So it really gives me an idea of what the balance is for your pet. Every test has its pros and cons. This one's no different. This test really requires a lot of interpretation. The Animal Biome test result will come back with recommendations for you. Unfortunately, those recommendations are created by an algorithm. They're not created by a person. And they don't know your pet's situation. They don't know your pet's diet. They don't know your pet's health challenges. They have a little bit of information because you check off a few boxes, but they really don't know any of the details. And so recommending a particular product, to me, has been not terribly helpful, because unless we get to the root cause, again, what caused that imbalance to begin with, just throwing a bunch of bacteria at it is not necessarily going to rebalance things. We really need to understand what the diet is, so we're making sure that we're feeding the bacteria that we want and maybe starving out some of the bacteria that we don't want. Other limitations of this test, we need to understand that the science of the microbiome, the gut, the skin, anywhere, wherever you're talking about, the microbiome is relatively new. It's really in its infancy. And every week we're learning more. And so recommendations this week might get changed next week, and we just have to deal with it and understand that it's just a matter of the knowledge increasing. This test is only looking at bacteria. And we know that the gut microbiome also includes fungi and protozoa and viruses. We're only getting a piece of that information. Even with all of those limitations. Oh, and the other thing to think about, you're looking at stool. Stool's only coming from the colon. It gives us some clues as to what's going on in the upper GI tract, but it really doesn't tell us what's going on up there. So we're getting such a small piece of the information. And even with all of that limitation, I have seen tremendous results from pets who have, we've successfully rebalanced the gut microbiome, and they are feeling a whole lot better. And I think that has to do with the holistic nature of things. If we can correct one piece, it starts to correct some of the other pieces. And so it's one avenue to access the imbalances and the challenges that your pets are having. Now, if you would like more information about the gut microbiome, I've talked about this before. There will be links somewhere, maybe on the screen here, maybe down below in the description, for other videos where I've talked about the microbiome, so you can learn a little bit more. Another test that I might do or might recommend for your pet has to do with nutrient testing. Vitamins D, B, and magnesium are critical for digestion. They're critical for just about every body process. Vitamin D is important for immune health, calcium deposition in the bones, for so many other things. Vitamin B12 is essential for normal energy production and digestion. And then magnesium, boy, that goes the gamut again, just like vitamin D, with over 300 functions, including healing and nerve function and that type of thing. So I will sometimes recommend, especially for those patients that have had chronic inflammation in their gut, who have had maybe chronic pancreatitis, may not be absorbing the nutrients quite as well, or they've been on a very poor diet for a while. We may want to check those levels. I use VDI Lab for that. VDI Lab has been studying vitamin D for well over a decade. They have more information than any other lab that I know of. They have tremendous information on not just the associated diseases, but also treatments and some of the interferences with those treatments. So I've been using those for a long time. I have complete faith in their knowledge and the procedures that they're using. Now, the pros and cons on this test, they all have them. This one does require a blood test, and you will need to go see your veterinarian. Your veterinarian will charge at least a blood draw fee. If your veterinarian uses VDI lab, by all means, get it done through your vet and just send me the results. If your veterinarian doesn't have an account with VDI and doesn't want to, I can have the tests drop shipped to you. You bring them into your veterinarian, and the veterinarian, there's instructions on how to handle the sample and send the sample into the lab. I'll get the results, and then we can share those with your veterinarian. So the information that's provided with these tests is really important. There is still some interpretation that is essential for understanding the treatment and retesting protocols for these nutrients. One of the things, as an example, is vitamin D. We know that it's a fat-soluble vitamin. What that means is that it does get stored in the fat in the body. So, as it turns out, if your pet is overweight or obese, it may take a lot more time to reach an equilibrium state where we'd want to retest the values, the blood values, to see if we have reached a high enough level. It can take a few extra months, and it's really important to know when to do that next test and how to interpret that, because otherwise we can make adjustments that may not be really appropriate. Toxins are all around us. No matter how clean your pet's diet is, how clean your home, your yard are, toxins are unavoidable. Symptoms are totally variable for any of these toxins, and so we can't really identify specific symptoms that would say, oh, it's time to do this particular test. When we get to this point of testing, these are typically patients who are really, really sick. They're not responding to anything else. We've done the gut microbiome test. We've looked at their nutrient levels. They're fine. They're eating good, healthy foods, and they're still not responding. These pets may have exposure to toxins, and until we get rid of those, they're not going to get better. And since many of these substances, pretty much all of them actually, are toxic to people as well, your pet might be an indicator for toxicity in and around your home, which can be really important for other family members. Now, the test that I use, again, is from VDI Lab. Toxin testing is relatively new. Things like glyphosate are in the rainwater. They're in our drinking water. They get into the food supply, even the organic foods, in small amounts. You can find a lot of information about glyphosate, but it is extremely toxic. It affects liver, kidney, it can cause cancer. It is an antimicrobial, so it can affect the gut microbiome. It's really pretty nasty stuff, and it's everywhere. Other toxins can include mycotoxins. Those are toxins that are small molecules, and they're made by certain types of molds. Not all molds, but some of them do. Mycotoxins are hard to destroy. So even if you have gotten rid of any mold that you found, the mycotoxins might persist. And molds can hide behind the drywall. If you have a little leak in a pipe somewhere, you can get mold in your drywall and have the mycotoxins within your home. So you don't always smell mold, you don't always see any evidence of mold, and you can still have mycotoxins. So and one of those hidden potential toxins. They can be in food, grains most often. They can be outside in rotting mulch and compost, and there they do a tremendous help, but we don't want our dogs eating that stuff. And then they can also be in your home. And then, of course, there's heavy metals. And arsenic, cadmium, mercury, and lead are natural minerals. And so they can be pretty much anywhere. But they may be in certain fertilizers, so they can get into the food system that way. They are often used in industrial processes and can get into the air and the water supply as well. And heavy metals can interfere with metabolic pathways at a lot of different levels. And so the symptoms can be very, very varied. Just depends on where those metals are incorporating into the system. Now, the test that we do for heavy metals also tests the nutritional minerals, which is really nice because it can give us an idea if there's any nutrient deficiencies or excesses in the minerals that we need for life. It is interesting to note that one of the things VDI Lab has discovered, pets with mycotoxin issues and or with heavy metal toxicity seem to have much lower nutritional mineral levels. It seems that these toxicities may block the absorption or incorporation of those minerals into the tissues, and that can be really important, not just because it can affect the way we treat, but it's also important that we support those deficient minerals. Those can be contributing to the symptoms just as much as the heavy metals. So getting all of this information can be really, really helpful for your pet's health. Now, as far as pros and cons, lots of challenges with all of these tests. The good news is that you don't need to go to your veterinarian for any of them. Glyphosate and mycotoxin are done on urine. The heavy metal and mineral tests are done on fur. So you can collect those samples. I'll send you the kits, and then you just mail those in, and we'll get the results within a week or two. Toxin testing is relatively new. Not a lot of data. So normal values, acceptable levels are pretty sparse. And so interpreting those tests can be a bit challenging. And then treatment is very, very individualized. There are definitely ways of opening up the detoxification pathways, just in general, opening up liver and kidney and improving circulation and those kind of things. Those are helpful, but many of these minerals or the different toxins require very specific treatment. And in some cases, those treatments are not well tolerated by the pet because of maybe even the results of these toxicities. These pets are sick. So treatment can be a bit challenging. And then finally, one of the most important things that we do is remove the toxins from the environment. Well, that can be super challenging because we don't always know where it's coming from. Finding mold in your house, finding heavy metals in your water supply or wherever they might be coming from, can be time-consuming and expensive. But we need to remember that these toxins are also toxic to your family. So it's not just your pet's health we're dealing with a more holistic picture of everybody in the household. The last test I'm going to talk about today is the cancer screening test. Cancer is one of the most feared diagnoses that you might receive for your pet. And yet we know that cancer, when it's caught early, can often be treated successfully. The problem is that typically cancer is diagnosed at stage 3 or 4 when it really is not as responsive to treatment. So screening for cancer can be another life-saving tool. Typically, the immune system recognizes cancer cells and destroys them. But if the immune system is compromised, some of those cells may make it through. So if we do a cancer screening test and we find a positive risk factor, then we will immediately start supporting the immune system. But knowing where the immune system is compromised is really helpful for more targeted therapy. And that's where checking the microbiome can be important, because 70 to 90% of our immune system is lining the gut. And the gut microbiome is that first layer of defense within the gut. When that is compromised, things that normally would not pass through, would not be able to get into the gut, can get inside and potentially get to our immune system to cause some damage. So correcting the gut microbiome is critical. I mentioned vitamin D is essential for normal immune function. It's also one of the nutrients that's super important for catching cancers and killing those. So checking those levels, doing those tests can be really, really helpful. And then as I mentioned, some of these toxins, some of the mycotoxins, the heavy metals, and glyphosate can contribute to cancer risk. So finding the underlying cause, we can do everything we want to support that pet's immune system, but if they're still getting hit with those toxins, then we're probably not going to make much progress. So all of these tests kind of come together here in this cancer screening test as something that we might want to consider. Now, VDI has a cancer screening test that I have found to be very accurate, but it's accurate for some of the more common cancers like lymphoma. It will not do as well with some of the slower growing tumors. So this test really looks at the inflammation level in the whole body. It also looks at how much DNA is being produced. So if we think about cancer, particularly a fast-growing cancer, we're creating more cells, lots more cells, very, very quickly. There's lots of DNA to produce. In a slow-growing cancer, that may not happen quite so much. I use the VDI test because, again, they seem to be on the cutting edge, and they have been so good about sharing information about specificity and accuracy of their tests. And this was many, many years ago. This test has been out for quite a while. I recently saw a test result from a lab. This was done for a patient of mine through her regular vet, and it came back with a high cancer risk index. But I really couldn't find much information about the tests, the technique, what were they testing. It was all very vague on the veterinary end as well as on the report end. And so it didn't give me a whole lot of confidence. And then to add to that, this patient came back with a test that said he was high cancer risk. They went ahead and did a whole body CT scan, and it was perfectly clean. Now, that's not to say that the VDI test can't have false positives and false negatives, but that's not the way that I want my first exposure to a lab and a test to show up. I just don't have a lot of confidence in that other test. This one I do, and I will tell you, there are things that will interfere, so we get into the pros and cons of this test. Because it's looking at inflammation and DNA production, if there's an infection, that can come up as a high cancer risk because, again, you've got a lot of inflammation, you're producing a lot of white blood cells to fight that infection, so that can come back looking kind of like cancer. I had a patient years ago, and I probably won't ever forget this because it was such a surprise to me that they could tell the difference, but the test came back with a high cancer risk, but there was a note there that said, look for infection. The pattern here doesn't look quite like cancer. And sure enough, we found a hidden infection. We treated that, went back and retested the cancer screening test, and it came back normal, low risk. So even though the test has its interferences, sometimes it can still be very, very helpful. And then another con, if you will, to this test is that it's not 100%. Cancer is a huge conglomerate of various diseases. It's not one disease, and there's no way that there can be one test that will catch all of them. This test is really good for very fast-growing tumors like lymphoma, and the accuracy and specificity is fairly good, but it will not catch a slow-growing tumor, and I don't know of any test that will. So I've just given you a lot of information. I'd like to recap for you. The animal biome gut health test would be perfect for those patients that are dealing with a lot of chronic gut issues, inflammation, diarrhea, pancreatitis, that type of thing. The nutrient level tests will also be good for those patients that have had chronic inflammation in the gut. Maybe they're not digesting very well. Maybe they're suffering from some chronic illnesses that we just can't get to the root cause of, and that might be a nutrient deficiency. So that would be a good time to test those. When those come back as being okay and balanced and all, and we're still struggling, or we can't get these back into balance, that's when we might want to do some of the toxin testing, because the toxins can interfere with our ability to balance the gut microbiome and balance the nutrient levels. And then finally, if you have a pet that's older, maybe a pet that is genetically high risk for cancer, like a golden retriever or a boxer, those would be good pets to consider a cancer screening test for. If you feel like your pet might benefit from any of these tests that I've mentioned, or if you still have questions about those, I encourage you to leave some comments below, or you can join our new Discord server. Our Discord community is a place where pet owners can get together and share information, ask questions about holistic pet health or nutrition. And finally, if you have specific questions about your pet, we invite you to fill out the contact form that's listed in this description below.